again, Dr. Jennifer Savage. I'd like to welcome Amanda Brunner. She's also a Master's in Athletic Training student in our program. And today she'll be talking about the risk of heat-related illnesses in marching band members.
All right, thank you, Dr. Savage. I'm Amanda, like she said, and this is my presentation on heat-related illnesses in marching band. So just some background information that I thought was important to include in this. Approximately 4,000 people in the U.S. Die from a heat stroke annually. Aside from that, the incident rate of heat-related illnesses among high school athletes is around 9,000 cases a year, and it's highest during football season, which is not uncommon. And then heat-related illnesses are the third leading cause of death in high school athletics. So my focused clinical question for this presentation was, how does heat-related illnesses affect high school and collegiate marching band members? My search strategy included patients that were in high school and collegiate marching band. The intervention was heat illnesses. There was a brilliant comparison. And then my outcome was the effects and risk of heat illnesses. So my inclusion criteria included articles that were published between 2010 and 2021. They had to be in English. They had to contain information about marching bands and heat illnesses. They were excluded if they just focused on the general population. So just some types of heat-related illnesses that were included in the articles that I looked over were heat edema, heat rash, heat cramps, heat syncope, heat stress and exhaustion, and just overall heat injuries. Risk factors for these illnesses are going to be things like high temperature and humidity, heat waves, age, obesity, hydration, concurrent infections, alcohol consumption, and then drugs, and then comorbid medical conditions. So for the first article that I used, it talks about core body temperatures with collegiate athletes, collegiate marching band members. So they used two NCAA Division I college marching bands using 19 individuals from those two bands. There were 10 from Band A and 9 from Band B. They had 13 females and 6 males. You could be included in this if you were over the age of 18 and you participated in band in the fall 2018 season. You were excluded or could not participate if you had problems swallowing, gastrointestinal issues, or other medical disorders that prevented you from swallowing, because during this study they had the members swallow a core body temperature sensor 6 hours before the study, and this just monitored their core body temperature throughout their practices, rehearsals, and competitions, sorry. So the main outcome of this was just the measurements of the core body temperature as well as the wet bulb flow temperature and relative humidity were taken during and after activities, like I said, for rehearsal and competitions and games. Variables such as time, intensity, body surface area, hydration characteristics, and medical history were also included in this. The results showed that during competitions and rehearsals, their core body temperatures were within 1.1 degrees Celsius, and the majority of the participants included were severely dehydrated. The next study I used was Beat the Heat. This study was actually done by a nurse, and she was a school nurse for a high school. She saw that they were severely dehydrated and were coming into her for heat illnesses. So she implemented a water bottle belt, which you can see in the picture here. This was just to increase the consumption of water throughout their practices and other activities that they did. The result of this, implementing this water bottle belt, was a higher consumption of the water, and then as well as an education on heat-related illnesses to the marching band staff, because a lot of the staff that she was seeing were not educated properly in what to look for with different heat-related illnesses. The last article that I used took injury log or sickness log from 378 nursing clinics during their band camp. There were 178 students from the first, and then out of the 596 visits from the second log, there were 224 students that visited her. And of these 378 clinic logs, most of the marching band members that she saw complained of musculoskeletal injuries that were correlated with heat-related illnesses. So the clinical bottom line for my research was that it's vital to properly monitor weather conditions, hydration, and the use of emergency action plans that are set in place for marching band members to protect them and prevent these heat illnesses from occurring. Proper training and education should be addressed to marching band members, staff, just about the different signs and symptoms, what to look for, and what they should do to prep to reduce this from happening. So, implications as an athletic trainer, why do I care about this? It's just been suggested throughout the research, but there's not a lot of research on band at all, and especially for heat-related illnesses, but they have, what I've seen, is suggested that marching bands should have an athletic trainer on their staff just to help specialize in that, and that way the marching band athletes are getting the proper care and education and what they should look for when they're experiencing things like this. These are my references. And I just want to say thank you for accepting my presentation. Thank you to Dr. Savage and Dr. Clark and my classmates. Any questions?
I'm very interested in that core body temperature thing that you swallow. So does it measure other things besides temperature? And I assume it just, you just let it go with nature. So you can't have them very expensive, right?
So the article that I used that talked about that, it only said that it monitored their core body temperature and didn't expand on anything else that it monitored.
Right, so you're raising the question of retrieval, is that right?
Right. So if it did too much, then it would be too expensive. And so, but I wouldn't think you'd want to retrieve it. So, but
they didn't talk about reusing them, so.
Okay. But it would be interesting if you had one that did multiple measures.
Yes, ma'am.
While it was there and put it all together. So
Yeah, that's interesting.
I had no idea that device existed.
Me either. Yes, ma'am.
I had a kind of related question. I didn't mention that they measured like levels of dehydration as well in that study. They use the same thing to do that, or they use some other criteria to measure how dehydrated somebody actually is?
I don't think it's specified in the research. I think it was just based on you asked them how much, if I remember correctly, it was how much they drank before the practice or their competition and then during, and that's how they got that information.
Were there any ways that they talked about to incentivize people to drink more? Besides making it available, of course, which that's a nice nudge.
Not really. I mean, I did color guard here for 6 years,
Yeah.
and I did band in high school. And the staff that we had for each band, they pushed drinking water, but it's basically on the student or the member to drink the water on their own, because you can lead a horse to water, but you can't let them drink.
Any other questions for our speaker? All right, let's thank her again.